Health experts nationwide are concerned about these protests and the aftermath with respect to COVID cases. So let's talk about the scientific reasons for these concerns and what we can do to keep ourselves safer. Our 9 Health expert, Dr. Payal Kohli, is back with us. So obviously seeing what you see, face coverings or not, those crowds at times very much packed in, Dr. Kohli.
Yes, Tom, absolutely. And in fact, these protests couldn't have come at a worse time because we were in a very vulnerable period as we were relaxing the stay-at-home orders and saw an uptick in cases already happening. And then you can see with the protests, they're sort of the perfect storm for really creating what we worry about as a super spreader event. As we saw in the pictures, social distancing can be very difficult because there's such large crowds of people. There's also more droplet spread for a number of reasons, partially because people are screaming and shouting. There's use of tear gas, which can cause people to cough, and that can certainly spread droplets. Similarly, with the pepper spray, that can make people sneeze. We also saw some dumpster fires that can also irritate the airways and cause people to cough. And the tear gas can also cause tearing, which by some reports has been shown to also, cause spread of COVID-19. There's certainly less hand hygiene, more contact with surfaces, and people rubbing their face if they come into contact with tear gas. And as you know, some studies have shown that 25 to 50% of people can be asymptomatic spreaders. So when you get that many people together in one area, the likelihood of having an asymptomatic spreader is extremely high.
Both between watching tear gas waft in crowds and then hearing from many of our crews that have been out there that it is, even after it's long gone, it is still present. It reminded me of viral droplets and how sometimes things just do stay in the air for a while and you have to be aware that they're there. So now the mayor would like the protesters to make sure that they're being tested. Do they need to be tested right away, or is it something where they don't need to be or shouldn't even be tested for a little while?
Yeah, testing is a really important point after these protests, and that's because it's one of the few tools that we have to actually mitigate the effects of the protest. So what I would recommend is that people either go get tested at the first sign of symptoms, or if they're not having symptoms, then they wait about 5 days on average to get tested. Because if you get tested too early, you could have something called a false negative because enough viral particles haven't really built up in your bloodstream or in your nasal passages for the test to detect it. So usually about 5 days is good for the average incubation period of the virus. But it is important to self-quarantine, Tom, before you get tested, because you can imagine contact tracing is nearly impossible in these large crowds with so many people. So just assume you have it until you get your negative test result back about 5 days later.
From a COVID standpoint, what would you tell someone who's going to participate in a protest? How can they best defend themselves?
I would say that the peaceful protests, Tom, are much less likely to be spreader events than the ones that are not peaceful or violent because there's less chaos, less shouting. In general, you want to make sure you wear those masks. Try to do that social distancing. Carry your hand sanitizer. Try to wear some eye protection. Don't wear contact lenses, and don't wear makeup if you're a woman.
All right, Dr. Payal Kohli, good to see you on a Monday. Thanks again.